Hello, I'm Jade, an occupational therapist working in Bristol Royal Infirmary. Today's video is going to be on delirium, or known as acute confusion. What is delirium or acute confusion? Delirium, or known as acute confusion, is a common but serious but often treatable condition that starts suddenly in someone who's unwell. People who develop delirium may need a longer stay in hospital or the intensive care unit. It can affect 75% of patients in the intensive care unit. What are the causes of delirium? You may have experienced a cardiac arrest which could have reduced your oxygen to your brain. Other factors which cause delirium are developing an infection, medications which you may have been prescribed, surgery, pain, or sudden medication changes which you normally take. However, due to becoming acutely unwell, the doctors may need to revisit what medications you're taking during this period. Also, constipation and dehydration. You may also be at higher risk of delirium if you are older, have an underlying brain disease such as dementia, stroke, or Parkinson's, use of multiple medications, or excess alcohol use, or being in an unfamiliar place as well and not having a normal routine, especially sleep. What does delirium look like? Delirium can affect different individuals in different ways. There are different types of delirium. In hypoactive delirium, you may become agitated and restless, and this is the easiest to recognise. People with this type may be restless and have rapid mood swings and often hallucinate. In hypoactive delirium, you may become drowsy and withdrawn, also appear sluggish and withdrawn and not interacting with others. Patients can also fluctuate between both of these presentations, which is known as a mixed delirium. They may not understand who they are or what is going on, which can be very distressing. They may be talking about things which might not make sense and unable to follow conversation properly, or unable to remember what's being said during a conversation. They may see things or hear things which they think are real, or include thinking people are trying to hurt them on purpose. They may also be very slow and have a change in mood. They can present as a lack of interest and emotion, or short in temper. Sometimes these symptoms can be worse in the evenings or overnight. They can be better within hours or days, but sometimes it may take a longer time to recover from delirium. There is no set time period. How can we reduce the risk of delirium developing? To reduce the risk of delirium, regular orientation is important. You may see our staff providing an orientation board if a patient is in the intensive care unit within their bed space, which prompts us to know where the person is and what day it is. Getting up and moving can also help. Occupational therapists and physiotherapists may ask family or friends to get involved within therapy sessions, as it may help with engagement and a familiar face. Also, ensuring we know information about the patient. Family and friends will be asked to fill in information such as a patient diary, or gathering what we call a social history to help the ward tailor the care to the individual. What can relatives and medical staff do? Family and friends can help with speaking in simple sentences and being calm and patient. Trying reorientation strategies such as helping a patient understand where they are and what is going on. Also talking to them about events which are happening at home, or interests and what's going on in the news. Bringing in own clothes and items into hospital to help normalise a routine. Letting staff know if there's any routines that they normally have at home. Ensuring they have glasses and hearing aids, or anything which they normally help with communication that they require. To be understanding and repeat a sentence if a person doesn't understand. Healthcare professionals can help with regular reorientation and routine, trying to support with the continuity of care and same staff seeing the patient if this is feasible, getting the patient up and regularly mobilising, engaging the patient in tasks if appropriate, or putting on music and TV programmes which they may like, encouraging visits from family or friends and exposure to familiar objects, normalising a sleep-wake cycle, ensuring routine, and trying to prevent napping during the day. Does it have any lasting effects? There's no time limit on how long delirium can last. Delirium is a serious event which should get better as patients recover. Some patients who have had delirium can have long-term problems with brain function, for example concentration or memory, but other patients can make a complete recovery. Some patients who have delirium have had very vivid dreams after their illness, and this can happen for up to 2 months afterwards. A person may have distressing memories of delirium and sometimes linked feelings of fear or anxiety for months afterwards. Those close to the person should support them to talk openly and experience their feelings. If they keep a diary of the person at the time of delirium, they can use this to help the person make sense of that experience once they're getting better, and also seek support from others when required. Recovery and returning home. Delirium may have resolved prior to discharge, however some individuals have ongoing symptoms whilst they're still recovering. Some patients will have no memory of their time within the intensive care unit or hospital admission. Others can find it distressing to think about it because they may have found it a very frightening experience. Whatever their memories, it can take a patient some time to recover emotionally from a critical illness. When they feel able to, some people might find it helpful to try and piece together what has happened to them within the intensive care unit and what treatments they've had. This helps them to make sense of what was imaginary and what was real, because it can be very hard work to figure that out, even weeks after hospital admission or ICU stay, to read their patient diary of what has happened to them. And it's possible if they would like to go back and revisit the intensive care unit. It can be very difficult for the patient to do, but it can help them make sense of what has happened to them. Some patients may not want to remember what has happened and may not want to talk about it. Others may find it painful to remember their time in hospital and may need time before they can start to begin to think about what's happened to them. We offer a telephone call for patients who have been within the intensive care unit and deemed as high risk for more than 4 days as part of a follow-up several weeks after they've been discharged from hospital. We ask questions about your recovery, and this can be an opportunity to talk through delirium. Here are some links and resources to further understand delirium. I hope that the video has been helpful in understanding some signs and symptoms of delirium and for better understanding. Thank you for watching.